One of the big issues that the public was raising was if there was such a crisis to have to force something through in a very short timeline, why was the implementation date for this healthcare plan pushed back to 2013? It seemed inconsistent with what was saying, and I think the public picked up on that, and I think that was a legitimate argument of saying, look, there's a credibility gap here. What's being said and what's being done seems to be two different things. Well, first of all, it's really to earn the right to ask the American people to trust us with a program as important as healthcare. And one of those things is to address the issue the president says 2/3 of a cost of an expanded healthcare commitment can be paid for by eliminating waste, fraud, and abuse. Then we should be eliminating that waste, fraud, and abuse first and foremost to earn that right to be able to basically promise more benefits up front. So that's going to be a real challenge when we get into it is, are we willing to do the heavy lifting first before we start wanting to take credit for promising the world? Well, I think a great way to expand healthcare would be to allow individuals to have the same tax benefit that people in big labor and big business have right now, the employer provided. That tax benefit should be available to all U.S. citizens, regardless if the employer provides it or not. And I think that's something we can understand and agree on across the board. I think the across state lines issue is something that we all need to be pushing for. There's going to have to be some standards, but we want to make sure that those standards are not being used as a way to block expanded choice for consumers. So there are some states where you only have a few carriers. I think one of the biggest concerns is that we don't want to continue to block consumer choice, and we don't want to replace consumer choice with a federal mandate. I think tort reform is the elephant in the room that everybody in Washington wants to avoid. The trial lawyers have scared away anyone from talking openly and frankly about it. Now, somebody who was a county supervisor in California providing the safety net for 3 million people, tort reform has to be upfront a major issue. There's no way you can talk about cost containment without being willing to take on the trial lawyers and do the right thing about tort reform. And with all the talk that people have about this country or that country having healthcare systems, they don't want to bring up in those countries do not have the tort exposure that we have here, that the lawyers need to get out of the operating room. We need to take the lawyers out of the hospitals and allow doctors and patients to make those decisions and make it in an environment that isn't always under the threat of litigation. Well, the people are proposing a single-payer system are not only proposing a single-payer system in tradition of England or Canada. They're proposing one that will be 5 times larger than any healthcare system in the world. We forget, we're not talking about England or France or Canada. Canada would be comparable to California. We're talking a system that would be comparable as if the European Union mandated a one-size-fits-all for all of Europe. That is what's being proposed right now in Washington when they talk about single payer. So we should be very, very concerned about that. And I think that even those individuals who like the European model will understand and do understand that there's a big difference between Ireland providing a single payer system and the European Union. What's being proposed in Washington is not the European model. It is a model that doesn't exist anywhere in the world and hasn't existed since the Soviet Union. And we all know what happened in the Soviet Union. I think historically we have seen that when Washington takes over a program like that and tries to manage it out of D.C., that quality drops dramatically. And I have to just say, if you just look at the healthcare system in Washington, D.C. right now, you've got facilities that are so substandard that we'd never allow it into our own neighborhoods. Do the people of the United States really want Washington mandating and dictating the healthcare system for the rest of the nation? I think they really are concerned not to. I think the town hall meetings is a great reminder, especially those of us like myself who was a mayor, that this is what makes this country work, is the ability of the citizens to participate in one way or the other. And I found it very exciting. There were those who were strongly opposed to what was being proposed in Washington, those who were strongly in support of it. But they were able to dialogue and be able to talk. And that's one of the reasons why I was very frustrated with the leadership in the House of Representatives trying to mandate and force through a program before the American people even got to read it, let alone the members of Congress be able to read it. The fact is that I think that the town hall meetings is what makes this country different than a lot of others, is that citizens not only expect an ability to have a say, they demand it. I have to believe that the really sincere members who understand that they don't know it all here in Washington will come back with a message from their constituents that they need to be more diligent in the way they're approaching this, be more measured, and understand that when it comes to health care, quality does matter even more than how fast the legislation goes through. And that this is a program that the American people will have to live with for a long time. We're not talking about just the health care system for our grandparents or ourselves. We're talking about a health care system that our great-grandchildren will have to live with. And with that responsibility comes a huge concern by the American people that we do it right the first time. This is not one that we're going to get a chance to rewrite it. And if we do it wrong, we're not only going to see a whole lot of problems with our healthcare system. I think the Congress is going to see a whole lot of problems coming next election.